Good evening, Barbadians. As promised yesterday evening, I told you that we would come back this evening to report to you in terms of this evolving situation as it relates to the COVID-19 pandemic in Barbados. I'm here this evening, and with me is the Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostic, the Attorney General, the Honourable Dale Marshall, and the Chief Medical Officer, Dr. Kenneth George. As I said at the outset, yesterday when we reported, we spoke of a trend of increasing numbers of cases of COVID being related to a bus crawl that took place on Boxing Day. That trend has continued, and overnight, with continued testing, I can report that there have been an increase in the numbers of cases associated with this bus crawl, with at least 161 at this time related to prison inmates and indeed prison wardens and civilian staff of Dodds Prison. I should say at this time that over 1,000 samples have been taken from persons at the prison, that is prison inmates and prison staff, and 161 positive cases out of that. In addition, there have been some other positive cases associated with this same bus crawl, but not for persons who were working at the prison, other persons who attended. What I can say at this point in time is that the Ministry of Health and Wellness's team are on the ground in terms of the contact tracing. Over 100 persons are involved in this process, and they're working every day of the entire weekend and certainly into the late hours of the evening. Thus far, the contact tracing has been quite successful in that a number of persons have been tested and have been interviewed, and certainly you can see in the result of the call for persons who might have been at this bus crawl or who had come in contact with persons who were on that crawl. A large number of persons turned out at Eunice Gibson Polyclinic earlier today, and of course we had to provide transportation for them to be transported to Best dos Santos lab, where testing was also being facilitated. The Ministry of Health and Wellness team has been extremely active today in terms of making plans and looking at this evolving situation. We have, of course, to look in terms of what we have available in terms of the lab. I'm pleased to report that we have certainly 50 to 60,000 swabs available. We have over 100,000 rapid test PCR test kits available, and we have some on order. And I know that the Minister will speak to this in greater detail. The lab has additional staff, and there's certainly no backlog at this stage, but they're certainly involved in processing samples, as you would appreciate, even now, from swabs that were taken during the course of the night as it relates to the prison, and indeed as it relates to the actual contact tracing. We've also looked at our facilities at Harrison's Point in terms of the capacity, and I know that a number of you would recall that we said that it has a capacity of just over 200 there. In addition, we have provision for an additional 30 persons, and we have adequate beds. I should say at this point in time, because of the evolving nature of the process, we're obviously looking at other areas where persons can be accommodated. For example, the Blackman Gollop School, which was used in March this year. As it relates to the prison, a number of prisoners are positive. At the prison, there is presently a quarantine area which can accommodate 100 persons. And the plan is to use that for persons who are positive to be an isolation center at the prison, within the prison. I think most of you would be aware that the prison can accommodate over 1,100 persons, and there's adequate space in terms of that. In addition, there is a medical facility which we believe can be outfitted to be used in terms of seriously ill persons, in terms of an isolation for seriously ill persons. So we are looking at all of these areas as it relates to that. We are looking also, we have not taken our eye off the ball as it relates to the quarantining of visitors at the hotels, because we knew we had some issues with this, and I believe that this is something that we continually actively addressing. In addition, we have also been looking at our health facilities, and the QEH is making some initial provisions. I think many of you might be aware that in March, the QEH had put in place a COVID response plan. And that has That is now being implemented, not fully like it was then, but certainly they're making provisions in terms of separation and how patients are triaged at the accident and emergency department, and there are plans afoot in terms of shifting parts of the accident and emergency department, in terms of shifting certain outpatients clinics to allow for greater separation in terms of patients when they're being triaged. We also plan to make certain changes, and we've had discussion with the Evangelical Association and the Barbados Christian Council in terms of certain measures that will have to be taken, and the Attorney General will speak to those matters as we go through this program. At this point in time, I want to invite the Minister of Health and Wellness, Lieutenant Colonel Bostic, to speak to you in terms of the health details and more detail, and he will be accompanied by the Chief Medical Officer. Thank you.
Good evening, everyone. The Minister Walcott, who is the chair of the Cabinet Subcommittee, would have given a detailed account of activities over the last 24 hours or so. And as he indicated, the teams from the Ministry of Health and Wellness, those doing contact tracing, those doing testing, would have worked assiduously overnight into the wee hours of this morning, and then recommencing around 9 o'clock or so, and they are still at work trying to get to the bottom of this situation. We would have indicated that we felt that 48 hours was sufficient for us to be able to test the entire prison population, and I can report that we have achieved that, except for those persons who were on leave and so on, and there are about some 90 persons who should have reported today for testing at the Best Dos Santos testing site. Those tests would have yielded the results indicated by Minister Walcott, and we are continuing the process because this is the strategy that we have to use in order for us to be able to contain the spread of this virus. We will continue our contact tracing until we get every single primary contact in particular and all contacts related to persons who have already tested positive. I want to say also that we are very thankful for those persons who would have answered the call today, the persons particularly who would have been involved or attended in the bus crawl, and we would expect that that would continue, but we would make an appeal for those primary contacts. If you were primary contact, it means that you had you were exposed to some person who was on that bus crawl who would have tested positive. There are people who are turning up, and we are not going to turn back people, but we have to prioritize our testing so that we get those primary contacts. And then persons who feel for some reason that they were exposed to a primary contact, those are the ones who we would have to look at after the primary contacts. We are looking at extending hours for some of the facilities over the weekend to be able to respond to the need for swabbing or testing so that we can have the matter at least a certain way by Tuesday, as indicated by the Prime Minister when we got the 2 bank holiday days. We are on top of this situation in relation to the prison as far as testing is concerned, but it goes beyond that. We still have a lot of work to do. There's still a lot of other legs that we have to pursue, but we intend to do so and to be able to control the spread of the virus in Barbados. Those are the opening words that I'll give you, and I will await questions when question time comes. I'll now ask the Chief Medical Officer, Dr. George, to come and speak to you. Dr. George.
Good afternoon, everyone. So as to augment our testing capacity, the Ministry of Health will be opening our polyclinics tomorrow and the 2 bank holidays on Monday and Tuesday from 8:30 to 4:30 p.m. to augment our ability to test. These clinics include Winston Scott, Edgar Cochrane, Morris Bayer, Randall Phillips, and the Glebe Polyclinic. As was mentioned, there are a total of 1,130 inmates and staff at Her Majesty's Prison. We swabbed a total of 1,033 persons. That represents about 91 to 92% of the total population at the prison. Recall that the population of the prison is approximately 788 prisoners, 347 members of staff, and there are some civilian staff that total 35. As we mentioned, this is a work in progress. Even as I speak, our numbers are being updated, so it is difficult to sometimes at any one point in time give you an accurate information, but this is the information that we have. We encourage persons to contact the hotline. We have added 10 additional lines to the hotline, so there should be not much difficulty in persons accessing the hotline. And we have bolstered our staff at the hotline so that Barbadians and visitors alike who feel they may be in contact with an individual who was a positive case can seek medical attention and be tested. As was said today, we had over 600 individuals turn up to test at the Eunice Gibson Polyclinic, and we tried our best to accommodate all. I take this opportunity to remember and remind persons that it is very important that during the pandemic you follow the health officials' judgment. We are all here to assist in the process. Wearing of masks, washing of hands, and social distancing is absolutely critical at this time. We intend to test all prisoners and staff at Her Majesty's Lodge in 5 days. I'll be willing to take further questions when questions come up. Thank you so much.
Thank you, Dr. George, and I will now ask the Attorney General, the Honorable Dale Marshall, to speak to you. Thank you.
Good evening, Barbadians. I think by now you recognize that an integral part of our management of this COVID pandemic in Barbados is the establishing of certain legal rules and norms by which Barbadians are expected to abide. You would know also that in the last few days we did a special curfew directive, but obviously given what has emerged, it has been necessary to expand on the arrangements that we put in place in terms of restrictions. And therefore indicating to all Barbadians that effective immediately, we now have a new special curfew directive. And this special curfew directive, in some instances, revisits some old things, and in other instances, establishes a few new norms. The first thing I'd like to emphasize is that all of the rules established by this current directive will run from the 2nd of January, that is today, until the 14th of January. The Prime Minister has indicated that this will be a 14-day period, and of course, 2 days have virtually gone. The curfew, just to remind you, it was announced yesterday, but the curfew period is now between the hours of 9 p.m. and 5 a.m. We've had all kinds of discussions about how this is to be interpreted, but let me just make it clear. During the hours of 9 p.m. and 5 a.m., no one is to be on the roads of Barbados, out of their residences, anything of the sort, unless they fit within 2 exceptions. The first of those exceptions is one that's quite familiar to us, and that would be if you are an employee or a member of an essential service. And I remind you, we had a discussion on this in the early days of our previous lockdown. We were talking about doctors, we were talking about security guards, security officers, we were talking about firemen, nurses, all pharmacists, all of those kinds of professions. They're considered to be essential services. But we have learned from a few of the challenges in our early directives, and we want to make it clear that there is another very obvious exception, and that is if you have to leave your home because of an emergency situation. This was not previously spelled out. We've tried to learn from areas where we felt we could tighten up. So in addition to being a person who is part of an essential service, if you have an emergency, then common sense would dictate that you would have to be able to leave your home. Now, there are some businesses that would be affected by this rule. And just as we did in the early stages of the lockdown, of the previous curfew arrangements last year, we are making provisions for entities or individuals who are affected by this curfew to apply for exemptions. Now, we are allowing certain entities to open or to continue to operate. All manufacturers are going to be allowed to operate 24/7. Gasoline stations, 24/7. Hotels, villas, and other rental accommodation, 24/7. But there are other establishments in Barbados that need to work around the clock that don't fit within these three headings, and they're therefore encouraged to apply to www.gov.bb, that is the link, www.gov.bb, and request an exemption. One major change will be in respect of religious worship. I'm able to say to you that earlier today, the Prime Minister, myself, and others had a very productive, consultative session with the faith-based organizations in Barbados, not just the Christian faith, but the Islamic faith and others, to discuss with them the impact that the kinds of COVID numbers that we're seeing now will have on their operations and the possibility of risk of spread should they continue to function as normal. I'm pleased to be able to say that at the end of that consultation, the faith-based organizations have agreed and accepted the recommendation of the government of Barbados, and this has now been enacted in our directive as follows. Firstly, that places of religious worship shall only open for the conduct of funeral services, which shall be attended by no more than 10 mourners, one officiant, the funeral director, and any other necessary staff. This should harken back to you in terms of what we had in the early days of our lockdown last year. Secondly, and I think you would anticipate, weddings are also going to be affected, and therefore we go back to those early arrangements. Weddings shall therefore, during this 2-week period, only be attended by the bride and bridegroom, 2 witnesses, and the marriage officer. And finally, in relation to the day-to-day conduct of religious services, the churches have agreed, all of the religious institutions have agreed that they will cease face-to-face functioning, and therefore we are providing in this directive for the streaming and conduct of religious services at which only 3 persons, including the officiant, shall be present. So just to recap, funerals will be permitted during this 2-week period, but they will be attended by no more than 10 mourners, 1 officiant, and the funeral director, as well as any necessary staff. Secondly, weddings will be permitted during this 2-week period, but can only be attended by the bride, bridegroom, 2 witnesses, and the marriage officer. And thirdly, in terms of regular, what you would consider to be the regular type service activity, Sunday morning, Saturdays, Monday night, Wednesday nights, and so on, those events can only take place with 3 people being present. And of course, you may either stream or you may not stream. That is discretionary. I think everyone recognizes the incident that has given rise to this particular directive, and therefore it is important for us to limit the kinds of social activity that Barbadians have become so accustomed to engaging in, and at the same time have been so reckless in terms of their participation. You will therefore not be surprised that we have now determined that no person shall host or attend a party, a recreational or competitive sporting event, a banquet, ball, dance, or reception, a meeting of a fraternal society, private or social club, or civic association or organization. In addition, you may not host or attend the social event known as a bus crawl or a lime. You may not attend a karaoke event. You may not host or attend a picnic. You may not host or attend any bus or other vehicular excursion. In relation to the beaches and the parks, we are prepared to allow Barbadians to continue to access beaches and parks, but only for the purpose of exercise, or in the case of a beach, for swimming. And in the event that a group of persons intend to gather at a beach or park, those persons must be from the same household and shall not exceed 10 persons. That is the extent of the new directive. Let me remind you that we already have a COVID number 4 directive of 2020, and to the extent that those provisions have not been altered in any way by this special curfew directive, that directive continues to be in play. So Barbadians need to consider both directives, the number 4 directive and also the special curfew directive. Given the importance of causing people to limit their interaction, the matter of the public service takes on significance. Let me remind Barbadians that this is not a lockdown. We are not shutting down the country. We are instead putting the brakes on certain activity that we consider to be high risk. So we've therefore decided that where public servants can work from home, they will be allowed to do so. The details of this will be fleshed out by the head of the public service and the permanent secretaries, who will meet on Monday. And this meeting will determine specifically which public servants will work from home and which will come in. And this will be communicated to the members of the public service by your respective permanent secretaries. This is not new. This worked for us very well during the last shutdown. In the same vein, though, you would anticipate that the same issues that could arise in terms of public interaction with the public service, they could also arise in relation to public interaction with private sector entities. And the Prime Minister will be engaging with the head of the private sector with a view to asking the private sector to facilitate those employees who can work from home where it is possible for them to do so. Again, this is not reinventing the wheel. We've been here before. Finally, I indicated to you that we are putting the brakes on bus crawls. I indicated to you too that this special curfew directive is only for the next 2 weeks. I believe that you will have seen the kinds of ads that are out there encouraging people to come to bus crawls. You've seen the one called Brandy and Panani. You will also, no doubt, have seen another one scheduled for the 23rd of June called a no underwear bus crawl. These bus crawls are obviously a clear and present danger in terms of the closeness and the interaction of the individuals participating in them. So while this directive is banning bus crawls for the next 2 weeks until the 14th, I can say to you with absolute certainty that when the 14th comes, we are going to be extending the ban on bus crawls beyond this current period. We're in this dreadful position simply because of the intrinsic nature of this kind of event, and we simply can't afford to permit them to continue at this time. I'm available, as my other colleagues are, for questioning.
Thank you, AG. Before I go to question, just one or two things I needed. There's a clarification. I believe the CMO said that I said that all persons at the prison had been tested. That is in fact correct. I believe there's some confusion based on what was stated by the chief medical officer. What he's saying is that they've completed their first test, but a second test will be required for all of these persons after 5 days minimum. That is what is being. So I believe there's some confusion that persons are not certain if all persons have been tested or not. In other words, they've been tested, but having been tested, they now have to have a second test, which is the requirement in terms of clearing them in terms of COVID at this point in time. The Attorney General spoke in terms of the issues with the private and public sector, and I'd just like to remind all of you that back in June, when we were coming out of the initial closed, it was well recognized after meetings at the gymnasium of the private sector and the unions that indeed that lockdown can present several challenges to the Barbados in terms of economic survival, etc. And so we are doing this using the meeting with the private sector and the unions in terms of this process going forward. When I spoke, I talked about the importance of continuing doing the quarantine monitoring of persons at hotels. And it will be mentioned later in terms of the government's plan to introduce the use of bracelets that you've heard the Minister of Health and Wellness speak about for some time. I believe the plan is for the ministry to roll out the utilization of those bracelets on Wednesday, I believe it is, by Wednesday, so that they will be used in terms to monitor and tracking indeed not only visitors, but certainly in a situation like this. In addition, having said this, we focus on the prison, but I should inform you that the Ministry of Health and Wellness is certainly monitoring. I believe it's possibly, well, the bus crawl is one cluster, a large cluster, but there are 2 other clusters being monitored, and the contact tracing is being done, and the testing is being done on the West Coast. One involving 7 cases, and another one involving 4 cases. One involves a visitor, and the other one involves a worker at a hotel on the West Coast. In addition, they are also actively doing surveillance and monitoring for possibility of 2 other clusters. There are no positive tests, but there's a person who was positive who went to various areas. The contact tracing has been done. Some testing has been done already. Results are back. Not all results are back, but there have been no positive cases linked to those cases at this point in time. So it's a large cluster. There are 2 other clusters, much smaller, one of 7 and one of 4 cases, and then there are 2 which might become clusters, but the work is being done, and the Ministry of Health and Wellness has them under control. As it relates to the matter the AG raised about the beaches and accumulating, I should warn you that the police and the security forces have drones will be deployed in terms of beaches and parks to monitor persons' activities. We are taking this extremely serious. Having said that, I want to ask if there are any questions.
Yes, sir. Good afternoon.
Good afternoon. Happy New Year.
Happy New Year, sir. I was curious, based on all the disclosure that's made, if patient 0 has been identified, and if so, how did they contract the whole thing that led to this current situation?
Is patient 0 in relation to the bus crawl?
Correct.
Okay, I will ask them.
Patient 0 has not been identified, but there's a lead which we are following. There's a thread, and that is under active investigation by the contact and tracing team. And if that leads to anything, I will certainly report. But at this point in time, we're just following that lead, but nothing that we can confirm at this time.
And I understand that bracelets are going to be deployed. I was also wondering if, rather in going forward, that visitors who would be in breach of quarantine if they're caught would be deported rather than merely jailed and fined.
Well, that one is a legal matter, and maybe I don't know if the Attorney General can shed any light on that, but to my knowledge, at the moment, we are operating with the current law.
Jailed and fined.
And that one is
Of the last question, let me make it clear. Barbadians are very opinionated on what kind of justice should be meted out to individuals. I also have my opinions. But at the end of the day, our doctrine of separation of powers prohibits us as the executive from stipulating what kind of penalty a judge or a magistrate should or should not impose. It is a fundamental tenet that the person who is hearing the case will determine the appropriate punishment in the circumstances, and this administration will be loath to say to any magistrate what fine or what other penalty he should impose. And I think that is really the highest standard of the dispensation of justice, and that is what we'll continue to obtain in Barbados.
Yes, good afternoon. Manzi from Nation News. Two questions for me. Firstly, you mentioned that there were 161 cases confirmed at the prisons. But you also mentioned there were other cases outside of that.
Excuse me, can you hold a minute? Can you hold a question a minute? I just want to make 2 points. First of all, in relation to the bracelet, perhaps the minister might want to say a bit more about the bracelets we plan to introduce on Wednesday, so that you all don't get the impression that we're just speaking about the simple bracelets that we've been using at this point in time. And secondly, in relation to the question about deporting persons who are positive, I think in terms of health care and in terms of good health practices and WHO guidelines, and certainly you can't deport someone who you know to be positive at that point in time. Just some clarification. Perhaps the minister wants to speak a bit more about the bracelets.
the bracelets referred to by Minister Walcott. They're not the bracelets that people are reporting that persons in quarantine are just disposing of, cutting off, etc. Those wristbands, those are wristbands that are, those are placed on persons by hotels. The bracelets that we are speaking about are tracking bracelets. They have a mechanism, they're tamper-proof, and they're also water-resistant. And as soon as anyone tries to do anything, an alarm goes off, and the command and control will receive those alerts, and we would then be able to respond. If a person goes out of the area that they're supposed to be in quarantine, again, the alarm goes off, and we will be able to respond and respond promptly. So this will give a level of comfort to us, especially based on the experiences that we've been having within the last few weeks. And so we expect to be able to roll out that program come Wednesday.
Thank you, Minister. Mr. Mulville. Colin Mulville, I believe. Colin.
My question, as I would have mentioned, you would have mentioned that there were 161 persons at the prisons who would have tested positive, but there were other persons who are being tested and have yielded positive results. Could you give me the overall number of persons that have been positive so far? Also, in your investigations into the cases, does that include the discovering if the variant from the UK, the more infectious strain, is present here in Barbados?
Perhaps I can answer your last question first. In terms of the variant, we've asked PAHO, and PAHO will be assisting us in looking at the genomics to see if indeed that variant is present in the Barbadian population. As it relates to the figures, I spoke specifically to the cases, positive cases from the prison system. There are some additional cases, and perhaps, as the minister stated, this is a continuous active process. Perhaps the best person to speak to that would be the minister, or would be the chief medical officer, I would think.
So from the information I have, yesterday we had 16 non-Her Majesty's prisons positive cases, and today we had 17 non-Her Majesty's prison positive cases. So that in addition to the issues at the prisons, Remember, we are still picking up cases that come into Barbados through the Grantley Adams International Airport. And all of those are going to be contact traced. So the contact tracing is not only island-wide, it's an island-wide process, and it not only involves the prison, it involves persons who enter through our ports of entry. In addition, with respect to the bus crawl, we are doing specific contact tracing with all issues related to the bus crawl. As you know, bus crawls make several stops, and we are going to go to those bars and make sure that the persons who are primary contacts are tested first. So there is a team that is working on the whole surrounding issues of the bus crawl. Thank you.
Dr. George?
I just wanted to add a little here. The 33 cases that the chief medical officer would have spoken about over the past 2 days, not all of those cases are as a result of persons arriving on island, but through the very contact tracing. It's just that those cases were positive cases, but not from Her Majesty's prison. But remember, there are other persons who have been involved in the contact tracing, and some of those also have tested positive. So I just wanted to make that clarification.
Minister Bostic, you mentioned that the first case
Patient zero has not yet been identified. So does this mean that we have community spread in Barbados? And if not, what's the difference between local transmission and community spread?
No, it does not mean that we have community spread. As I said, there's a particular lead that we are following. It is under active investigation. And if and when we are able to make the connection, then I will come and I will say that. But at this point in time, we are still investigating that matter, and I will report in due course. We are following. It is under active investigation.
Hi. Question is general.
When we are able to make the connection, then I will
Hello?
come and I will say that. But at this point in time,
The Attorney General.
Is there a question?
Yes, please. The question with regards to the court system. So right now you have the situation at the prison. What is happening with regular court cases in terms of persons being remanded?
Over to the Attorney General, thank you.
Well, your question is in two parts. What's happening to the regular court system, and then the question of people being remanded. I've had extensive discussions with the Chief Justice, and I need to say to you that given the situation at Her Majesty's Prison Dodds, we are adopting a policy of no person in, no person out. And therefore, in relation to remands, individuals who are before the courts for bailable offenses, wherever possible, those persons will be granted bail with the imposition of a variety of conditions. I think you would know from our criminal system that you can have bail with reporting provisions, which can sometimes be as effective as keeping a person on remand, on physical remand in Dodds. So a person might be asked to report, for example, on a daily basis to a police station. So those are options that we have available to us. In relation to those offenses where no bail either can be granted, so as for example in the case of firearms, or in the instance of homicides where a person is almost always remanded, special arrangements are being made for the establishment of temporary prison facilities. And this is not new. This was done when we had the prison fire. The Barbados Defense Force has a prison facility there that they have agreed to stand up for us. And it is absolutely secure. And as I said, this was also available to the government of Barbados back when the Glenderry prison burnt. So this also is not new. In relation to court cases involving individuals who are currently on remand, those I expect will be deferred for some time. Part of our challenge is, of course, going to be that even though we have the ability to do court appearances by Zoom from the prison, at this point in time, that requires a level of interaction and I don't want to say distraction, but it requires a level of dedicated activity by the prison resources, and we feel that it will be in the best interests of all concerned if those matters should be deferred for a short time. So in terms of criminal cases, those individuals will not be coming down. Only where necessary would they be putting in an appearance by Zoom. And in relation to remand, proper arrangements are being made for the remanding of individuals who have to be remanded, and individuals who can be bailed, who can get bail, they will be given bail subject to fairly stringent conditions.
Good evening, Attorney General. Hear me? Hi. What's the position with the 3 prison officers the health authorities were trying to locate? Earlier today, we heard consultant for the Barbados Prison Officers Association, Caso Franklin, said that authorities at all times knew the locations of the men and that they had already been tested. What can you tell us?
Let me say that the prison is considered to be a disciplined force in Barbados. And there are certain protocols, there are certain rules and regulations which govern the conduct of prison officers. A prison officer is not a clerical officer in the public service. Certain specific instructions were given. Based on my complete understanding, those instructions were not followed by the prison officers. They were required to report to the prison facility for testing. They were so informed that was not done, and then they could not be located. The individuals were all located by the Royal Barbados Police Force efforts last night, and they would have been sent to the facility that was established for that purpose.
Going back to my question regarding the variant, the testing for the variant. Could you tell me when the
Mr. Mounsey, your question then is for whom?
For any of the medical personnel, Dr. Walcott, or the chief medical officer. You said that you have enlisted the help of international agencies, PAHO, I think you said?
I said PAHO. We've reached out to PAHO to provide assistance to do the specific genomic testing to see if the variant is presently in Barbados. We can't tell you otherwise.
So you don't have identity time frame. Okay. And the second question is regarding the bus crawl. Permissions would have to be granted by whom in that respect? Would the COVID-19 monitoring unit would they have signed off?
Can you repeat your question for me? And do you mind turning on your video that I can see you and respond to you clearly and concisely?
Can you see me now, sir? Yes, as I was asking, with regards to permission for the bus crawl, the COVID-19 monitoring unit, would they have been asked to grant permission for that event? And did they do so?
I'm wanting the minister to speak to that. I'm not in a position to say if they had asked permission. I don't think they did, to the best of my knowledge, but perhaps the minister can speak to that.
The bus crawl was unknown to us, and I'm sure that you can appreciate that whether or not they had requested permission, we have to deal with what we are dealing with right now and then deal with those matters afterwards, because the most pressing thing is to contain this situation.
Does this include the 45 from yesterday?
Who is it and what's the question? Can the person identify themselves?
Harry Bidding, News.
Could you repeat your question?
Can you please give a breakdown of the 161 cases? Does this include the 45 from yesterday?
I believe yesterday we said there were 45 cases from the prison. We are saying today that there's now 161. 48, I believe, are prison wardens and staff, and 113, I believe, 48 and 113, 161 are inmates of the prison.
Okay, my second would be for the with regards to tomorrow. Are you asking businesses to close to help with the contact tracing? Because persons would have been going out and about today, and you had a lot of places closing during the day as they realized that persons would have gone to the super spreader event. So are you asking businesses to kindly close tomorrow in addition to having the bank holidays on Monday and Tuesday?
I think that the journalists would know that very few businesses are open on a Sunday. We've determined specifically that we're not shutting down the country, but that we, of course, need to put certain structural arrangements in place so as to facilitate contact tracing. Our way of dealing with that was to establish that Monday and Tuesday, which would ordinarily have been full working days for all of Barbados, are public holidays. And we're therefore not asking, first of all, Barbados to shut down. And we anticipate, given that churches will now be closed, other than those people who are going to the kinds of businesses that would ordinarily open on a Sunday, maybe the supermarket, maybe a hardware store or something like that, most of those people should be at home and within reach. So the answer to your question is no, we are not asking anybody to close other than those businesses that will be required to close under the directive. And just to be clear, only those businesses that would have opened between 9 in the night and 5 in the morning are the ones that would be affected by the curfew. This is not a lockdown at this point.
Hi, Attorney General Marsha Guinness, Barbados Advocate. You spoke about a ban for bus crawls, but also yesterday it was mentioned of persons being on a cruise. So would you be banning cruises on pleasure crafts in future as well?
Let me say that, and let me repeat for you Clause 5 of the directive. No person shall host or attend a party, a recreational or competitive sporting event, a banquet, ball, dance, or reception, a meeting of a fraternal society, private or social club or civic association or organization, the social event known as a bus crawl or a lime, a karaoke event, a picnic, or a bus or other vehicular excursion. We think that this will cover just about everything.
And just clarity, gyms are still open.
Is that a question or a statement?
I'm asking.
You're asking me if gyms are still open, sir?
Yes.
We are not closing enterprises in Barbados. The Prime Minister indicated, however, that should we not see some responses from Barbados demonstrating responsibility within the next 72 hours, we are more than prepared to come back and tighten up even further. There are protocols at this point in time established in relation to gyms to secure physical distancing and sanitization, and we don't consider it necessary at this point to shut them down.
I just wanted to clarify if the passes for essential people is still active, although it would have been only used
Thank you for that question. Thank you for that question. The passes that would have been issued to individuals during the last occasion when those passes were issued, those passes relate to a state of emergency in play at that time. And even though there's continuity, we went to Parliament and established a new state of emergency, and therefore new passes are going to be issued. In any event, you would recognize that when we had the total lockdown, a large volume of persons required passes in order to be able to function. That was when we had a 24-hour curfew. This curfew is only operating between 9 at night and 5 in the morning. So only those individuals who have to be on the road during that period would require passes, and therefore it is prudent for us to issue new passes under this current legislative regime and not reactivate or not continue all of the passes that were issued last year.
Hi, good evening, General. Ms. Ron Robinson from Capital Media. There have been growing concerns regarding access to designated private transport for those traveling to and from testing centers. Will there be any concentrated efforts to have private transport to those going for testing?
Let me defer to one of my colleagues with the specifics of that question.
I believe the question is about private transport. I believe that was utilized today in terms of transporting persons who had participated in the bus crawl to facilitate them being transported from the Eunice Gibson Polyclinic to the Besta Santos testing facility. That was today. Tomorrow, as the CMO indicated, from tomorrow, we're opening a number of other polyclinics available for testing Sunday, Monday, and Tuesday from 8:30 until 4:30 p.m. It is the expectation that persons will make their way to these polyclinics. When there were only 3, we were helping you, but now we are going all into a number of polyclinics to do this. I believe Morris Bayer Polyclinic, the Brantford Haight Polyclinic, the Eunice Gibson, Winston Scott Polyclinic, the Randall Phillips Polyclinic, 6 Roads, and the Polyclinic at the Glebe. So it is expected that persons who know that there were part of the process would make their way to those clinics. They have 3 days to do so. They'll be open not to treat cough and cold or to see people, but specifically and only for testing of persons, for swabbing of persons. In addition, there is a press release which will be going out shortly with this in mind. Thank you. Are there any other questions?
Yes, Senator Doctor, I wanted to know about the situation regarding 2 supermarkets and a number of South and West Coast eatery establishments that have chosen to close in the air of caution. How is this going to be treated or cooperated with by government, if at all?
I believe this has to do with the whole process of contact tracing and people being upfront. Some establishments recognize that members of staff might have been to the bus crawl, and I know that one supermarket chain has procured its services to have a number of staff tested. I believe some other restaurants have been proactive in this regard in terms of speaking to the Ministry of Health and Wellness and also facilitating the entire process in terms of contact tracing. So in that regard, government is working with them.
Aaliyah Briggs, CBC News. My question is for the Attorney General. Have you encountered any businesses that were unable to provide a customer contact list for contact tracing? And if so, will they face legal sanctions of any kind?
I'm not involved in the contact tracing, so I'm entirely unable to say whether we have or have not found any businesses that are cooperating. That answer would have to come from the CMO. Let me say, though, that under the existing directive, any business or entity that gives any false information or does not cooperate with the authorities is subject to penalties. So there are consequences to individuals who feel that they don't have an obligation to support the efforts of the government in this regard. But I repeat, I cannot say whether there have been any businesses or persons who have refused to cooperate. That is not my understanding.
Non-prison cases in terms of the 33
I'm
cases.
afraid the first part of your question was completely lost.
Sorry, my question is for the CMO. Can he give a breakdown of the non-prison related 33 cases and also speak on the new clusters?
Just going to be very general. There have been 2 clusters and 2 cases under investigation. And those clusters have been brought to the attention of the Ministry of Health. And we have put several resources in this to make sure that the contact tracing is complete. The contact tracing is not done overnight, and it's a process, and as we get more information, we will certainly pass it on to you. With respect to the other question, if I heard it correctly, the CMO has the authority to identify quarantine sites and to keep people in quarantine for a period of time. If those are broken, persons will be liable to be convicted under the laws of Barbados. So we're asking the population and we're asking visitors alike, please comply with the quarantine rules and regulations of Barbados. It is important not only for your safety, but the safety of the entire population. As we try to address the issues confronting us at the prisons, we cannot fight another fight on another area, having people breach quarantine and cause us further headache. So it's about cooperation and trust in the healthcare system that we holding your hands could get over this crisis. This crisis is not the first that has occurred in Barbados. As you know, there have been several instances of such in the region, and we can work through this together. We have been given additional resources, and it's going to be tough, but we could work through this together. Thank you.
I have
Cases that the prison.
I don't hear. Not hearing your question.
I have to repeat, Kerry.
Dr. George, can you please give a breakdown of the 33 non-prison related cases?
I don't have that, sorry, I don't have that information for you at this point in time. As I said, it would have been a combination of both some contact tracing and some persons coming through the Grantley Adams International Airport. Thank you.
Dr. George? Regarding these new tracking bracelets, are the tourists, are they supposed to stay within their rooms for quarantine, or are they allowed to traverse the hotels, etc.? There was a case of tourists removing the bracelets and walking by the poolside, etc., at one of the hotels. Can you just
Those
speak to
were
that?
not, please try to distinguish between the tracking bracelets and the bracelets to identify risk. Those are wristbands. Those are red, amber, green, whatever, indicating different categories. Persons may remove the wristband for many reasons. It may be illegal, but they may have removed the wristband when their quarantine period came to an end. So seeing a wristband on a beach is not the cause for acute alarm. The other bands that we will be using are Bluetooth-enabled geofencing technology, which when activated, a person will not be able, an alert will be sent if a person moves out of a particular geographic zone in terms of feet. So if you moved out of your original place, there will be warnings and alerts sent, and that is intended to contain and make sure that people do not leave a specific jurisdiction. Thank you.
In addition, I believe that if you attempt to remove the bracelet, it will trigger, they will know that you've turned to take it off. Are there any questions? I know that the Ministry of Health personnel have to get back to the Health Emergency Operating Meeting because, as I said, this is a continued process. If not, I want to thank you all for your participation and for your questions. As we said last week, we remain open in terms of this COVID pandemic, and certainly since the 31st of this month with this evolving situation primarily at the prisons. I want to, you've heard the discussion, you've heard the presentations. I want to again try to allay the fears of Barbadians. There's no need to panic. We need to be calm. We need to be calm and careful and safe and be, as I said a week ago, to be or look after our welfare, our life and our livelihood and that of our brothers. And indeed, I want to commend Barbadians for coming out in their numbers, to be tested, and we're speaking about persons who might have been related or interacted with someone who attended this bus crawl. As you have heard, that we've not only focused on the bus crawl, but we are still working on these clusters, 2 definite clusters, and 2 that we are doing the contact tracing for that are not yet be declared of clusters. Our health workers are working extremely hard. The lab people are working all through the night, and so they're working in this process. I should say that in terms of the hotel situation, I've heard from the Minister of Tourism that there was a meeting, the BHTA and hoteliers again, in terms of trying to more rigidly enforce the quarantine recommendations within hotels and restricting the areas in which those who are quarantined and those who are not should abide. You've heard from the Attorney General, and I think it is understood, that the whole process of the public holidays is merely to assist us in our contact tracing, so that as we tend to contain this disease and certainly try to contain it by trying to do the contact tracing and quarantining persons and isolating those who need to be isolated, but also trying to reduce transmission of the disease. And though it is a fluid process, it is a very intense process. It can be a difficult process, but it has to be done, and we need your cooperation. And indeed, the whole process of giving you Monday and Tuesday is for you to relax and not to go all over the place, but be in a position where if we need to reach you, we need for you to assist in the contact tracing, that we can easily find you. We have not closed gyms. The Attorney General has said that you're allowed to go on the beaches, but no picnics. We want you to exercise. We want you to be safe. We want you to look after yourselves. But we also want to let you know that you've seen a gradual process in terms of the measures that we've implemented as a government, to let you know that whatever happens, we see the safety and health of every Barbadian as a priority, and we will do whatever we need to do in terms of combating this disease, containing it, and indeed reducing transmission. I thank you and have a good evening.